everyone. My name is Laura, and I'm here today to discuss the contribution of stress induced signaling pathways to drug craving and addiction. I'll do so by introducing the concept of stress versus chronic stress, as well as discussing the physiology of the HPA axis, before divulging into how chronic stress relates to drug addiction and presenting clinical research findings of various sorts relating the two together before concluding today's presentation. So, first of all, what is stress? Many people over the course of their lives have experienced stress, which is a dramatic physiological and psychological response to a specific event. It's also a biological response to demanding situations that can cause the body to release hormones such as cortisol and adrenaline, which increase the heart rate and breathing rate. Many factors can trigger a stress response, including dangerous situations and psychological pressures such as work deadlines, exams, or sporting events. With stress inducers being so widespread and various, it's estimated that the global average for the number of stressed people is at around 35%, but it can be as high as 74% in countries such as Afghanistan or Sierra Leone, and even 55% in the United States of America. Although these short-lived feelings of stress are a regular part of everyday life, when they become chronic, they can have a severe negative impact on a person's health. Chronic stress, on the other hand, is a prolonged and often overwhelming feeling of stress that can negatively impact a person's daily life. Potential causes can include high-pressure jobs, financial difficulties, traumatic experiences, poverty, dysfunctional families and marriages, and even challenging relationships. According to Mariotti 2015, chronic stress is linked to macroscopic changes in certain brain areas, consisting of volume variations and physical modifications of neuronal networks. For example, several animal studies have determined that chronic stress leads to volume reductions in the prefrontal cortex and the limbic system, and altered neuronal plasticity due to dendritic atrophy and decreased spine density. Additional imaging studies also identified basal ganglia atrophy and reduced gray matter volume in the prefrontal cortex of chronic stress patients. These morphological alterations are similar to those found in the brains of depressed patients examined postmortem and suggest that they could also be at the basis of depressive disorders that are associated with chronic stress in humans. In fact, it's been demonstrated that chronic stress increases the risk of developing depression. But in all, symptoms of chronic stress are often manifest as insomnia or sleepiness, changes in social behavior and emotional responses, appetite changes, aches and pains, as well as increased alcohol and drug use. The hypothalamic pituitary adrenal HPA axis is one of the main stress response pathways in the body. Neurons in the paraventricular nucleus of the hypothalamus release two neurohormones, corticotropin releasing factor and arginine vasopressin, into the blood vessels connecting the hypothalamus and the pituitary gland to stimulate the anterior pituitary gland to produce and secrete adrenocorticotropic hormone into the systemic circulation. In fact, the ACTH will then induce glucocorticoid synthesis and release from the adrenal glands, which are above the kidneys. And the main glucocorticoid in humans is cortisol. The HPA system is carefully modulated through negative feedback loops exerted by cortisol on the hippocampus, the PDN, and anterior pituitary gland to maintain predetermined hormone levels and homeostasis. Of its two receptors, mineralocorticoid and glucocorticoid receptors, cortisol preferentially binds mineralocorticoid receptors, and it maintains this low blood cortisol levels during normal circadian rhythms by doing so. However, when cortisol concentration is really high, as in stressful situations, cortisol will bind glucocorticoid receptors with a lower affinity, and that terminates the stress response. As emphasized earlier, this homeostatic mechanism of cortisol is critical to maintaining good health. HPA axis activity is determined by genetics, early life environments, and current stress levels. A healthy stress response is characterized by a quick rise in cortisol levels, followed by a rapid decline with termination of the stressful event. When the organism is burdened with cumulative stress, however, cortisol burden increases, and this results in wear and tear on the organism from a continued exposure to the catabolic properties of glucocorticoids. Ultimately, in chronic stress patients, glucocorticoid receptor resistance develops, the negative feedback loop begins to fail, and the systemic levels of these modulators of stress are staying high, and this compromises the immune system and damages our organs in the long term. This ultimately will burden the organism and can influence the development of neuropsychiatric and of metabolic disorders. Drug addiction is a chronic neuropsychiatric disorder characterized by the compulsive intake of drugs of abuse and the loss of control over this consumption despite devastating consequences. According to the World Health Organization, drug addiction affects up to 6.6% of the population worldwide, and it's a major contributor to the global burden of disease and disability, meaning it's worthwhile to investigate scientifically. Most addictive drugs are dopamine agonists and cause elevations in extracellular levels of dopamine. Therefore, when rewarding stimuli, such as drugs of abuse and their accompanied euphoric feelings, are experienced, the dopaminergic mesolimbic system is activated and causes the release of dopamine to the targeted nuclei. The mesolimbic dopamine system is excited not only by rewards, but also by aversive stressful stimuli, which further intrigues the complexity of this relationship. So, therefore, stress is now known to be a key risk factor in addiction initiation, maintenance, relapse, and ultimately treatment failure. And stressful life events can impact the risk of addiction by increasing impulsive responding and self medication. Subsequently, the relationship between stress and drug addiction has been investigated in the lab from several angles, and I will begin to discuss some of the findings. As previously mentioned, childhood traumas are a major source of chronic stress, and such stressful life events can increase the risk of addiction. In particular, studies have shown that a history of childhood trauma is more frequent and more severe among women with alcohol and drug dependence than among men with the same diagnoses. Therefore, Tucci et al. 2010 aimed to analyze the frequency and intensity of child neglect and abuse in subjects who searched for outpatient treatments for alcoholism or drug dependence and evaluated the influence of gender in these indicators. To do so, at the State University of Sao Paulo in Brazil between January 2003 and March 2004, 295 patients were included in the study, including 85 who were alcohol dependent, 70 who were dependent on other drugs, and 70 patients who had a diagnosis of depression or dysthymia. Patients with bipolar disorder, mental retardation, schizophrenia, or organic disabling disorders were excluded from this group, and the control group included 70 patients who did not meet the criteria for alcohol or drug dependence, but they did seek care in a primary care health setting. Neglect, physical or emotional, and or abuse, emotional, physical, or sexual, were evaluated using the childhood trauma questionnaire, which was translated into Portuguese. And this is a questionnaire of 28 items that evaluates retrospective experiences of childhood abuse and neglect. The chi-square test, the one-way ANOVAs, post-hoc tests, and logistical regression analyses were all appropriately applied by the researchers, and statistical significance was determined at p is below 0.05. As the first of its kind study accounting for these gender disparities, this Brazilian paper observed a higher frequency and severity of these traumas among abusers of alcohol and other drugs than patients that had depression or that were in the control group, specifically with a higher frequency among women than men. Histories of physical and sexual abuse were significant risk factors for both alcohol and drug-dependent women, though physical neglect was only a risk factor for other drug-dependent women. Physical abuse was a significant factor, on the other hand, for alcohol and drug-dependent and depressed men, though emotional neglect was only a risk for other drug-dependent men. Along with previous findings, Tucci et al.'s findings suggest that early intervention for childhood victims, especially females, may delay or even prevent the early onset of alcohol use and reduce the risk of a more severe course of addiction. So now, having confirmed that stressful life events can influence drug addiction and even instate it, we may now be wondering, how does the stress from these traumas actually affect drug craving and relapse? Given that hypothalamic CRF systems are thought to be involved in cocaine reinforcement and in relapse, Sinner et al. In 2006 aimed to examine whether stress-induced or drug cue-induced cocaine cravings and HPA axis responses were associated with subsequent cocaine relapse. In New Haven, USA, this study included 49 cocaine-dependent individuals who were not dependent on any other psychoactive substance besides alcohol or nicotine, and were not taking any medications for medical or psychiatric reasons at the time. Subjects were exposed to a stress, a drug cue, or neutral script guided imagery, and it was a different one for every day of laboratory testing. Cocaine craving was assessed as a 10-point visual analog scale that measured whether the respondents were having a desire to use cocaine at the moment and to what extent. Heart rate was measured with an electronic blood pressure monitor, and plasma samples for corticotropin and cortisol assessments were processed by standard radioimmunoassay procedures. All laboratory responses were assessed at baseline, which is 5 minutes before imagery, during, and immediately after imagery, and at repeated recovery time points 15 minutes away from the imagery. Now, all participants were also given a follow-up interview at 90 days after discharge from the inpatient unit, where all these tests were administered, and cocaine use during baseline, that is 90 days before the inpatient treatment, and during follow-up, which is 90 days after discharge, were assessed using the substance use calendar, and urine and breath samples of alcohol were also obtained. So the following cocaine use measures were used to complete the relapse analysis, and that includes time to relapse, the frequency or total number of days of cocaine use, and the quantity or average amount of cocaine used in grams per occasion of use. As seen in figures A and B, stress-induced corticotropin response with a significance of 0.002 was significantly associated with the average amount of cocaine used per occasion in the follow-up period, and overall, the high corticotropin responders used significantly more cocaine over time than the low responder groups. Ultimately, stress-induced corticotropin and cortisol responses were not associated with the time to cocaine relapse, but they did predict higher amounts of cocaine use per occasion in the 90-day follow-up, and this is seen by the difference in the white and the black triangles in figure B. This is consistent with the clinical literature that recognizes that relapse and recovery are multi-determined processes. And so the current findings are really suggesting that specific components of the stress response are associated with different aspects of the relapse process. But overall, with this in mind, ultimately, how does stress manifest these cravings and relapse physiologically? It is well known that all drugs of abuse act directly on the ventral tegmental area and the nucleus accumbens to increase midbrain dopamine levels. And it's also known that stressful stimuli impact the mesolimbic dopamine pathway. Therefore, given the profound effect that stressful stimuli has on facilitating initiation and reinstating drug self-administration, Sally et al. In 2003 examined whether an acute stress has a similar effect to that of drugs of abuse on synaptic strength of excitatory synapses. To accomplish this, C57/BI6 mice, which were 21 to 30 days old, were subjected to a modified Porcel forced swim test in 6 Celsius water for 4 to 6 minutes as a stressor. Saline, which was volume matched for experimental conditions, cocaine, which was administered as 15 milligrams per kilogram, the glucocorticoid receptor antagonist RU486, which was administered at 40 milligrams per kilogram in DMSO, or the NMDA receptor antagonist MK801 at 1 milligram per kilogram in saline, were administered all 15 to 30 minutes before the cold water swim. This justifiable dose of RU486 was chosen based on previous published findings, showing variable efficacy of around 20 to 25 milligrams per kilogram, so this dose was more than sufficient. The 24 to 30 hours after the test, the animals were unfortunately sacrificed and the midbrain slices were prepared. And this was done in order to test the synaptic strength, which was measured as the ratio of AMPA receptor currents to that of NMDA receptor currents. There were virtually no differences in the results between the blinded and unblinded experiments, so the results were mixed together. Ultimately, the AMPA to NMDA ratios obtained from animals who were administered saline, experienced stress along with the administration of saline, were given the NMDA receptor antagonist MK801, or were given the glucocorticoid receptor antagonist RU486, were summarized in figure B as shown. The asterisk indicates statistical significance of P is below 0.01, and the N values are all listed on the bars. The results in figure B indicate that stress affects excitatory synaptic strength on midbrain dopamine cells and requires the activation of NMDA receptors as seen in the stress and MK801 bar versus the control bar. Moreover, the administration of RU486 completely inhibited the synaptic changes originally seen, implying that there is a critical role for glucocorticoid receptor activation. However, RU486 did not prevent this ratio increase at all in cocaine-administered mice in figure C, where statistical significance was P is below 0.05. Now, this indicates that synaptic changes from cocaine exposure do not require glucocorticoid activation, while stress-induced synaptic changes do. Ultimately, based on these observations, Sally et al. Suggests that this enhancement of strength at excitatory synapses is a key neuronal adaptation that contributes to the effects of stress on drug seeking and relapse, and ultimately aligns with the current understandings of dopamine, the reward system, and drug addiction. In all, the relationship between stress and drug craving and addiction is multifaceted. As previously mentioned, childhood traumas are an example of chronic stress that can cause and are also known to increase the risk of drug dependency, particularly in women, and early intervention is critical for preventing the substance abuse. Moreover, stress induced corticotropin responses are correlated with higher cocaine consumption in relapse of cocaine dependent individuals, but not to relapse time, since relapse and recovery are multi determined processes. And lastly, as we saw, stress can increase synaptic strength at excitatory synapses, and glucocorticoid receptor activation is involved in these heightened midbrain dopamine levels. Ultimately, the mechanisms of action of stress signaling pathways to inducing drug addiction are complex and require extensive additional research to strengthen treatment and prevention models. I now invite any questions, and I thank you all greatly for having listened to my presentation. I wish you the best of luck on yours. Thanks.